Угу. Пошла трансляция, хорошо. Сейчас звук услышу. Все слышно, отлично. Ну, здорово. Сейчас я тогда им всем разошлю и будем начинать. Okay, maybe we can start. Hello to everyone, I'm glad to see you on my lecture. Today we will talk about disease of reproductive system. Mostly we will talk about female reproductive system, but few words about man reproductive system we can tell today too. Let's talking about structure of morbidity of diseases in patient of all population. Diseases of female reproductive system take about 30% of all cases in world disease. If we will talk only about women, the diseases of reproductive systems take something about half of all diseases in women, and mostly it will be diseases of mammary glands. So let's talking about mammary gland diseases. Before we will talk about pathological process in mammary gland, we should remember about normal structures of this organ. Mammary gland anatomically have nipple, area around the nipple, and inside of it, consists of milky ducts, lobes of mammary glands, fat structures, muscles, and ribs after the muscle. Histologically, we should remember that mammary gland is an apocrine gland. So it have apocrine cells, and which list all glands inside of it, and it have lacteal duct. So in non-lactation mammary gland you can see small glands, and in time of lactation after pregnancy and childbirth you can see increase of size of these glands. Normal histological structures like pictures, you can see that mammary gland have a duct, have lobules with apocrine cells, which formation acinus, and most important part of the mammary gland, of glands only, with a myoepithelium. Classification of diseases of mammary gland is same for all diseases of reproductive organs disease. It may be inflammatory diseases, dyshormonal diseases, and tumors. Inflammatory diseases includes mastitis, which may be purulent, infectionals, granulomatosis, retention, plasma cells. The most important of this disease is purulent acute mastitis in women after childbirth. You should recommend surgery and treatment for this patient, and mostly it will be young woman, young patient, age between 18 due to 30 maybe. Retentional type meeting in older people, in older women, and it associated with menopause and dyshormonal disorders. Necrosis of mammary gland tissue, it's usually associated with surgery and operation on mammary gland. In this slide you can see acute mastitis, his histological structures. The first part of this picture will be localization alveoli with secretory cells. The lumen of the mammary alveoli is filled with mucosa cathara, with neutrophils, macrophages, and lymphocytes. The cavity of the lactate alveoli filled with pink masses of exudate. Usually it may be fibrinous exudate or something else. Lipid necrosis in mammary gland looks like typical lipid necrosis, yes, you can see cells increased in size without nucleus, and the way looks like very empty, yes. What special stain for lipids you should remember? It's Sudan 3, Sudan 4, Charlach, and osmium acid. I think you remember about them. Troubles with link. Okay, I send it again. Oh, thank you. Right now we should talk about dyshormonal diseases. Dyshormonal diseases includes two types of diseases. It's benign breast dysplasia, like mastopathy and fibrotic cystic disease, non-proliferative forms and proliferative forms, adenosis, epithelial, myoepithelial, and fibroepithelial adenoma. Normal function of reproductive system organs depends on hormone levels. In background of increase of estrogens, we can see this disease. Very often in mammary gland of young patients you can find some nodules. It will be associated with benign breast dysplasia. These nodules may be spontaneous regress in time of pregnancy and childbirth. Benign tumors. Benign tumors of mammary gland includes intraductal papilloma, blood dysphere from the nipple, often solitary in subarachnoid region, rarely malignancy. Revolve treatment. Fibroadenoma is disease that you can meet in patient 30 or 40 years old, or often a single no more than 3 centimeters in diameter, with clear controls, mobile on palpation, not connected to the skin. Microscopically, this disease have 3 forms: intra-radicular, pericanalicular, and mixed. The more depends of classification of these diseases. Classification depends of type of growth this tumor. Let's see some pictures with diseases. In this slide you can see mastopathy. Mastopathy again. You can see these formation glands and big accumulation of connective tissue in gland. Intraductal papilloma, on this slide, you can see it in this slide, fibroadenoma with intracanalicular growth. It's again it. And this type is mixed form of fibroadenoma. In this slide you can see some areas with intracanalicular and pericanalicular growing of tumor. With mostly, you can see this picture in most cases of your patient. And today we should talk about cancer gland. And nowadays we have good diagnostic and scheme of treatment of this disease. In most cases of disease we can help patient if we start treatment in time. But something about 25% of cases of cancer of women population is a cancer of mammary gland. Critical age of this disease between 40 to 60 years old. But in nowadays we can meet some patients with this disease more younger. For example, some cases with patient in 20-25 years old. Clinically, deformation of the gland the appearance of retraction on the skin, skin under the gland looks like lemon peel, deformation and reaction on the nipple, the appearance of dysphagia from the nipple. Cancer of mammary gland have some special risk factors. The risk factors we should take two parts. One part of the most important way are late menopause, early onset on the first menstruation, late onset on sexual activity, late first birth, breastfeeding for more than a year, obesity, heredity. The risk is 2 and 6 times higher if the mother or sister has a breast cancer. Before menopause, and the risk 1 and 8 times higher after menopause. And it also may be associated with some mutations. And last important factors we are taking oral contraceptives, hormone replacement therapy, and some alcohol, smoking, and radiation injury. Microscopical forms of cancer of mammary gland. Usually we have nodular, diffuse, cancer of nipple and nipple area, which have second name Paget disease. You should remember that first two forms of nodular and diffuse mostly will be adenocarcinoma. Cancer of a nipple area, we will talk about them later. But all types of cancer of mammary gland have metastasis. Most important places for metastasis for us like doctors will be axillary lymph nodes, liver, bones, like in lungs. And you should remember that cancer of mammary gland have late metastasis, more than 10 years after first found of tumor and good treatment. Histologically, we have non-infiltration cancer, infiltration cancer, and Paget disease. Infiltration or non-infiltration cancer will be depend with growth under basal membrane of the gland. Non-infiltration doesn't grow. Infiltration grows from basal membrane to another structures of mammary gland. Paget disease is a cancer of nipple area. So, non-infiltration cancer have two forms, intraductal and intralobular. Paget disease have special morphological things. It will be eczematous, lesion of the nipple, and perineal field, combined with intraductal or intralobular cancer, and the most important for us like morphologists will be large light Paget cells, which you could see in these schemas and this picture. You can see these increased cells with light cytoplasma. The light color of this cytoplasma associated with increase of accumulation of glycogen in these cells. Macroscopically, manifestation of cancer of mammary gland. Microscopically, non-infiltrative intraductal cancer in mammary gland. It's again same process in this picture you can see. In this picture you can see carcinoma. Cells of cancer blocked the duct of gland like comedon. You should remember what is comedon from your cycle from dermatology maybe. It's same process, carcinoma, in this slide. On this slide we can see invasion of cancer. We can see invasion of atypical cells from basal membrane and which transplantate from another areas. In this picture it's tumor with big areas of fibrosis, solid cancer of mammary gland, it's again solid cancer of mammary gland, and SCIR. Classification of adenocarcinoma you should remember from our third model, which includes medullary cancer, solid cancer, and SCIR. In this picture we can see SCIR, big accumulation of connective tissue in this tumor. Paget disease, macroscopically, you can see deformation in nipple area. You can see skin for like lemon and another typical morphological manifestation of this process. Histologically, you can see increase of keratinous layer, and you can see typical Paget cells with increased cells in size with glycogen inside of skin of a nipple. Paget cells closer, you can see big accumulation of these atypical cells in mammary gland, and it's all about diseases of mammary glands in women. Let's talk about diseases mammary gland or in men. But in men we should remember that in classification anatomically there is no mammary gland in men. Men have a breast gland. So the most important disease of breast gland in men is the hypertrophy of breast, gynecomastia. It can develop with hormone. It can be associated with hormone therapy for prostate cancer, testicular tumors, and liver disease. It may be associated with a large consumer of beer also. You should remember about bad injury of alcohol for our organism. Right now we should talk about diseases of female reproductive organs. I mean, we should talk about disease of uterus, ovaries, and another reproductive organs of female reproductive system. Classification. I told that all reproductive organs have same classification. All diseases of reproductive organ may be inflammatory, dyshormonal, and it may be tumors. In this slide we can see normal structures of female reproductive system. This part will be uterine body, this is ovaries, this is tubes, and cervix, and after cervix we can see vagina. The most important for gynecologists will be cervical part, vaginal part of the cervix. You should remember that all different parts of reproductive system have different epithelium in it. In uterus we can see glandular epithelium, in vagina multiplier flat epithelium, and in cervix canal, we can see cylindrical epithelium. But in the part of the vaginal part of the cervix, we have multi-layer of flat epithelium. You should remember it. Picture with things of infectional disease or in cervix. For development of disease of cervix, we have background disease of cervix. Background or pre-cancer disease, you should understand it. Pre-cancer background, we mean pre-cancer. Endocervicosis or glandular pseudoerosion is a changing of the flat epithelium to cylindrical in cervix. Leukoplakia, I think you remember leukoplakia from the first term, is a change of a flat epithelium to squamous cell in cervix. Erythroplakia is a thinning of multi-layer flat epithelium on cervix, and it may be post-traumatic changes and epithelial dysplasia or TIN. About grade of TIN we will talk later. Microscopical picture of endocervicosis, we can see changing of this epithelium for cylindrical. Same manifestation of this process, but most big area we can see. In this part normal and in this part pathogenical process. In this slide we can see dysplasia first, maybe second stage, and in this slide you can see big cells with empty cytoplasma with big accumulation of vacuoles, and it mostly will be associated with virus infection. The most important virus for female reproductive organs, mostly for cervix, will be a virus of human papilloma virus. It's have pre-cancer damage of cells of cervix, and mostly it will be developed to formation of cancer in cervix. In this slide we can see epithelial dysplasia second stage, and we should talk about cervical cancer. Every year 528,000 new patients with cervical cancer are registered in the world, and 266,000 deaths from this disease. Mostly we can see it in patients in 40 or 49 years old, but nowadays we should remember that all tumor disease have young manifestation. Maybe you can see this disease in young patient in age 20-25. You should think about cancer all day and all time. The most typical growth of this tumor is exophytic. Histologically it's squamous cell carcinoma. I should tell you that you couldn't find any local resident of Canada with this disease, because they have vaccinated all girls in childhood against the human papilloma virus. So we have manifestation of teratogenous effect of this virus. You should recommend for your patient have vaccinate against the human papilloma virus. Risk factors of cervix cancer. Early sexual activity. The first sexual contact earlier than 16 years old, maybe earlier than 14 years old. Frequent change and a large number of sexual partners. In nowadays, it's very big trouble for all our society. Sexual infections, a low level of hygiene, early pregnancy and childbirth, injury of the cervix during childbirth. Smoking, oral contraceptive, the decline in immune status, and human papilloma virus, the most important factor of the risk. The most dangerous type of virus will be 16 and 18, with one less than this. Macroscopically, you can see cancer in cervix. It will be looks like that. One more picture with cancer in cervix. Epitel dysplasia, you can see like cells changed, and maybe in this area you can find carcinoma in situ already. Squamous cell epithelium, squamous cell cancer. The most typical manifestation of squamous cell cancer will be cancer pearls. You should remember it from our third model. I remind you again. Background: pre-cancer disease of cervical channel. Only one pre-cancer disease in cervical channel. It will be polyps of cervical channel. Cervical cancer have endophyte growth, and histologically mostly it will be adenocarcinoma. And it's all about cervical cancer. After in this place we talk about cervix all. We should talk about uterus. But before we start, we should remember about normal structures of uterus. You should know that uterus have two layers of endometrium. First layer will be functional, which disappear during menstruation. In this scheme, you can see it in this part of this picture. And second, the most important for recovery, basal layer, you can see it in this area. We should remember about changing of endometrium during menstruation cycle. Menstrual cycle have two phases: follicular phase and luteal phase. The first stage start from 0 day and during to 14 days. And we talk about them later. What you should to know: the most important hormones in first stage will be estrogens, and in luteal phase it will be progesterone. Proliferative phase corresponds to 5 due to 10th day due to 14th day of cycle. Endometrial glands are convoluted. The lumen is white. You can see it. Very strange form of glands in this phase. And stroma, you can find reasons of edema. Cell nuclei are large, and the number of mitosis decrease. Phase of secretion, second part of this scheme, corresponds to 15 due to 28th day of cycle. Active phase in endometrium under the influence of progesterone. You can see progesterone increased in this phase. So it have 3 stages too. First one will be earlier stage, which took from 15th day due to 18th days of cycle. The lumen of the glands is white, mitosis disappear, the stroma is relatively compact, and the mitosis are rare. You can see it in this picture. Middle stage of phase of secretion is the most likely day for implantation of embryo. Endometrium have sawtooth-shaped glands, sawtooth-shaped forms. You can see it like so. Maximum stroma, edema, appearance pseudodecidal cells contain glycogen with light cytoplasma, growth and twisting of the spiral arteries. And I should repeat it, it's the optimal time for implantation of embryo. Endometrium phase of secretion, the late stage of process. It took from 24th day due to 27th day of a cycle. Regression of the glands, increase folding of the walls, and stroma, maximum predecidual cells. You can see increasing of size of glands and its premenstrual days of cycle. Phase desquamation. It includes regression of the corpus luteum, sharp decrease in estrogen and progesterone levels, spasm in the spiral arteries, and like result of spasm the spiral arteries, you can find necrotic change in the functional layer, hemorrhage into the stroma of the endometrium, rejection of the functional layer. We should talk about tumors and pre-tumors disease of uterine body. Excuse me. Glandular endometrial hyperplasia, an increase in the endometrial layer, uterine bleeding. It's a most important manifestation of this disease. Microscopically, we can find cysts, enlarged glands linked with proliferation epithelium. Atypical gland hyperplasia, adenomatosis. In 100% cases transform to cancer. You should remember that glandular endometrial hyperplasia in less time have malignant form. Something about 5, maybe 10% of this disease will lead to malignization and formation of adenocarcinoma. A typical glandular hyperplasia, it's in each of case will be transformed to cancer. And polyposis of uterine body. It may be have one or more polyps, one or more nodules in uterus. In this slide, you can see microscopical manifestation of hyperplasia of endometrium. I remind to you, it's a benign disease. It's not. It's never have a malignant transformation. Cancer of uterine body have endo or exophytic growth. Histologically, is mostly adenocarcinoma. Sometimes it have non-differentiated cancer. Microscopical manifestation of process you can see in this slide. And in this one, same process, it's adenocarcinoma of uterine body, but it's cut off uterine part of it. In this slide, it's histologically manifestation of high-grade adenocarcinoma. It's about gradation of adenocarcinoma. You should remember from our third model. I hope you remember about gradation. And low-grade adenocarcinoma in uterus. You can find some difference between them. In this case, you can see twins cells, which looks like another. But in this slide, you couldn't find two cells which will looks like ones, or looks like each other's. Right now we should talk about one disease of man reproductive organ. It will be diseases of prostate. Classification same: inflammatory, dishormonal, and tumors of prostate gland. You should know that in exam we haven't any questions about prostate, but sometimes we may ask you some additional questions which may be associated with prostate too. One of the most important inflammatory disease of prostate will be prostatitis. Classification of prostatitis have maybe according to etiology. It may be infectionals or non-infectionals one. According to course, it may be acute and chronic. According to type of inflammatory, exudative and proliferative. So, exudative form may have serous, mucous, catarrhal, and purulent type. Proliferative type may have lymphocytic, histocytic, epithelial cells, and gigant cells type. What you should know about acute form of prostatitis? It's usually associated with some infectionals, with sexual infections, and usually it should antibacterial treatment. And if we will talk about chronic disease, we may be associated with some adenomas and secondary infectional process in this organ, and mostly will have more bad course of this disease. Benign hyperplasia of prostate or adenoma of prostate. It's a simple glandular form, papillary and cribrosa form, granular fibrose, mucous and glandular, and mixed forms. And PIN, prostatic intraepithelial hyperplasia. In this slide you can see scheme of prostatic intraepithelial neoplasia with low and high grade dysplasia and carcinoma. We have some border between normal and dysplasia and carcinoma, and I think in cycle with in surgery, in the late course, you will know more about this disease. Cancer of prostate. Morphologically, significance of malignancy is degree of malignancy is Gleason scale, worldwide scale of cancer of prostate. perineural or vascular invasion, capsule germination, and growing into the seminal vesicles and urethra. Scheme of the Gleason scale for adenocarcinoma of prostate, first due to fifth one. And right now we should talk about morphological forms of prostate cancer. Morphological forms will be acinar adenocarcinoma, the most important in most cases you will see acinar adenocarcinoma, ductal adenocarcinoma, urothelial carcinoma, and squamous cell carcinoma. Way meeting less than acinar adenocarcinoma. So right now we should see some slide with grade of cancer of prostate cancer. First stage grade, you can see increase of count of glands and something strange cells in these glands. In second stage, you can see a picture more bad than in first one. In third one, the fourth grade have three sub-grading. It's 4A, 4B, and 4C. Same for a fifth grade. So, this is the end of the first part of our lecture. Second part of our lecture will be about diseases of pregnancy. Excuse me. Diseases of pregnancy. Definition of these processes are diseases that pathogenetically directed related to pregnancy, complicated its course, and as a rule disappear after its end. This disease should disappear after childbirth, but we have some conditions that ended after 1 or 3 months after childbirth. You should remember it and know about it. Disease of pregnancy includes histosis, toxicosis or toxicemia, miscarriage, ectopic pregnancy, and trophoblastic disease. We should talk about histosis firstly. Histosis may be early histosis, which includes vomiting of pregnant women, vomiting less than 5 times in day, excrement women vomiting less than 8 times for a day, and materialism, sorry, I have mistake, ptialism in this part, ptialism. Second one, it's late histosis, late or EPH histosis. It includes edema, nephropathy, preeclampsia, and eclampsia. Preeclampsia includes manifestation like edema, proteinuria, and hypertension. Eclampsia, all with same manifestation plus convulsions. Diagnosis reasons of the EPH histosis: edema, proteinuria, hyperplasia. EPH. The most important steps of pathogenesis for all diseases of pregnancy will be kidney injury, the most important or most often morphological manifestation will be intracapillary mesangial glomerulonephritis, and like result in clinical manifestation we can see proteinuria. And second one step will be injury of placenta, violation of the development of spiral vessels, and like result of this injury we can see formation of thrombosis and necrosis in placenta. Morphological manifestation of eclampsia: edema and hemorrhages in the brain, toxic dystrophy in the liver, necrotic nephrosis, and dystrophic and necrotic change in organ, DIC syndrome. It's very dangerous conditions for our patient, and we should help this patient and save life of patient and newborn if we can. In this slide you can see lipid degeneration of liver, macroscopically manifestation of this process. In second slide you can see microscopically manifestation of this process. In this slide you can see necrotic nephrosis. You couldn't see any nucleus in these cells, in cells of epithelium of tube of kidney. Hemorrhagic stroke. And one more picture with hemorrhagic stroke. I should say it again. Eclampsia is very dangerous condition. It's mostly may be associated with death of our patient and newborn. Second part of this disease will be miscarriage. We have some classification this process according to time of it when it's happened. Up to 14 weeks it will be early miscarriage. Up to 22 weeks it will be late miscarriage. From 23 to 37 weeks it will be prenatal birth. For 38 due to 41 weeks it's in time birth of childbirth in time. After 41 weeks it postponed pregnancy. Critical terms of the treatment of termination of pregnancy. In time of the implantation, it's 2-3 weeks of dependent from 2-3 times from ejaculation. It will be implantation period. From 4th due to 12th week it will be placentation. So it's critical period too. And 18 due to 22nd weeks increase of the volume of uterus may be associated with miscarriage too. In this slide you can see microscopical picture uterus with fetus. Morphological criteria for late miscarriage. It's border between 22 and 23 weeks. Because in our country 23 weeks we should help and save life of this fetus and trying to saving life for this child. Morphological criteria: fetus weight less than 500 grams, Latin less than 25 centimeters, and gestation period is less than 22 weeks. If only one criterion missed, it will be early childbirth, not miscarriage, childbirth. Causes of this spontaneous abortion and premature birth. It may be associated with chromosome and gene mutation, endocrine disorders, genital and extragenital diseases of the mother, physiological factors, malformation of the uterus, and physical and chemical agents. Right now we should talk about ectopical pregnancy. Ectopical pregnancy include, mostly it will be tubular pregnancy. In this location, it's more than 25% cases. It may be ovarial pregnancy, abdominal pregnancy, and cervical pregnancy. But in this picture you can see some different type of ectopical pregnancy. But you mostly should think about tubular pregnancy. For example, if you have some manifestation of pregnancy in patient, but you couldn't see any specific things in ultrasound. In ultrasound, you should think about tubular pregnancy, and you should recommend surgery operation for this patient and makes abortion of this pregnancy. In normal cases, implantations happens like that in that place. It's most typical place for implantation of embryo. But in wrong way, you can met it in tubal in tube. It may be associated with some sexual infections, with some surgery manipulation. For example, surgery operation in abdomen cavity. You can meet some strength in this localization, and it will be leads to ectopical pregnancy. Causes of the ectopic pregnancy. It will be as inflammatory disease of the uterus and appendage of it, sexual infantilism, it's wrong develops of uterines and organs of reproductive system, malformations of uterus, adhesion and in the abdominal cavity, use of the hormonal and intrauterine contraception. Morphological signs of ectopic pregnancy. The tube is dilated. We talk about tube pregnancy because it's most cases. The tube is dilated with hemorrhages, the fetal eggs inside of tube. Histologically, harmonic villi fibrinoid deciduation reaction. We will see it in this slide, in next slides. Macroscopically, you can see part of tube and egg inside of it. You can see hemorrhage and in our morphological signs of ectopical pregnancy in this picture. Histologically, you can see big area of hemorrhages. You can see some villi formation, chorion formation in this part of slide. One more slide with same manifestation, hemorrhages, trophoblastic disease. It's last part of our lecture. includes molar pregnancy, as simple, maybe it may be proliferative and invasive. You should know what does mean molar pregnancy. A molar pregnancy is some special conditions which happens when oocyte may be impregnation by two spermatozoids, and it will be incomplete molar pregnancy. In case of complete molar pregnancy, you should have oocyte without genetic material. In some cases it may happen. So the most important difference between complete and incomplete molar pregnancy will be earlier die of the fetus in complete pregnancy. In incomplete molar pregnancy, you can see a die of fetus something about 1 or 2 weeks of development of this pregnancy. But in incomplete impregnation of oocyte by 2 or more spermatozoids, and the fetus will die something about 16 weeks of pregnancy. And most important to genetical material collection inside of cells of this fetus will be also important. Choriocarcinoma or chorioepithelioma, one of the most important malignant forms, one of the most malignant form of tumors in women. And placental polyp, it's trophoblastic tumor of the placental place. In this slide you can see molar pregnancy. You can see big accumulation of vacuoles inside of uterus. Some picture closer, you can see it, these bubbles. Histologically, manifestation and scheme of this process. The corpus of uterus, and inside of it big accumulation of these bubbles with vacuolization, vacuole transformated endometrium. Histologically again, and few words about chorion carcinoma. Chorion carcinoma was opened by Nikiforov in 1886. Microscopically, it's cytotrophoblast cells and gigant syncytiotrophoblast cells tumor. I should repeat, it's one of the most dangerous tumor with early start of metastatic process. The typical places of metastasis will be brain, bones, lungs, and in our organs. You can meet metastasis in any organs. Microscopically, it looks like wet. You can find these atypical cells inside this tumor. Macroscopically, it looks like wet. So, our theoretical base of our lecture will stop in this slide, and right now we should talk about examination case. Only one case with this theme you have in exam, and about examination slides. So you can see case number 18. A 58 years old woman during the prevalent examination in the right mammary gland where was related a painless formation which diameter about 6 centimeters without particular borders. The skin above this transformation is weak. Mammals deformate. Biopsy was made. Due to histological examination, the lumen of mammary gland channels, we see growth of atypical epithelium with large hyperchromical nuclei and formation of round cavities. You can see questions about this case. So I give something about 5 minutes for thinking about questions, and after that I will show answers to you. Try to answer by yourself. Сейчас в чатике. I am waiting for your answers. So I think I will never see your answers. So I show you mine. This patient have cancer of mammary gland, so it's Paget disease. The type of this tumor histologically is squamous cells carcinoma. The right axillary region we should find metastasis, because lymph nodes are located in this area. We should see your examination slides. The first one is fibroadenoma of mammary gland. You can see this duct of mammary glands in this slide. Second slide will be adenocarcinoma. I should remind to you, in exam you don't say adenocarcinoma for which organ. You should tell them only adenocarcinoma. You couldn't know which organ is it. Adenocarcinoma. In this slide you can see squamous cell cancer with cancer pearls. The most important manifestation of squamous cell cancer pearls. And